Good day, everyone. I'm Dr. Bevin. I head the emergency department at Sakra World Hospital. See, in healthcare, safety is everything. I'm an examiner for emergency doctors. So, you know who passes? The doctor who's safe for the patient is the one who passes. Okay? Knowledge level is good. That's always there. They will have it. They can always acquire it. But particularly if your practices are the ones which are towards safety, then inevitably you are automatically considered as a better doctor there. So now I would put it as like, see, safety is there in everything in the hospital side. Now it ranges from things like, now talk about a single medication. If a medication has to be delivered for a patient, it has to pass through the following things. If it is a new drug that has to come into the system, it has to go through something called as a PTC, or a pharmacotherapeutics committee. Then that will be audited further when the drug is in our so-called, it has to make our formulary for us to write that drug. If that drug is there in the formulary, and if suppose there is a prescription of that drug, that prescription gets audited. That prescription, once it goes to the dispensing side, that gets audited. From that point, it goes to the next part where it is delivered to the patient, where the administration of the drug is monitored. So at every level and every action, there is a particular checkpoint there, where we can trace back and find out if an error has happened. So safety is built into everything. So there are standard precautions that people have to take for each and everything. And just to ensure that the problem doesn't reach the patient, we have multiple layers of safety precautions which are put throughout the patient's stay. So whichever be the situation, whether it is a drug, I've given you the example of a drug, that also comes into other factors, like when you transport a particular patient, there are safety checks for that. When you hand over a patient, there are safety checks for that. There's a protocol and there is a safety check within that. So all in all, I would say, to summarize this, I would say that, no doctor can actually cure all conditions, but you can comfort and you can ensure that there's no further harm done. So that is the primary way we will approach this.